at least get going. The House Health Policy Committee will come to order. Would clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter.
Yes.
Hadsma.
Here.
Neely.
Here.
Glanville.
Here.
Cuffia.
Here.
Conlon. Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingans. Vanderwall.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz. Thompson.
Here.
Madam Chair, you have 16 members present. You do have a quorum.
Thank you. Representative Neely moves to approve the minutes from our meeting on February 6, 2024. Seeing no objection, the minutes are approved. Prior to testimony and votes, if you wish to speak or express your position on legislation before us today, please submit a card to the clerk. Sergeants in the room will be happy to collect the cards and get them to the committee clerk on your behalf. In the interest of time, you are also welcome to submit written comments to be submitted to the bill record. Today, we will vote out House Bills 4347 and 4348 and Senate Bills 57 and 58, which we heard testimony on last week. Then we will hear testimony on Senate Bills 44 and 45, which prohibit medical examinations without prior consent on anesthetized or unconscious patients. Go ahead, ease, call the chair. House Health Policy will come to order. First, we will take up House Bills 4347, 4348, and Senate Bills 57 and 58. Do we have any additional cards on those to read into? Okay. Representative Kofia moves to report House Bill 4347 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. House Bill 4347 is reported with recommendation.
Thank you. Representative Neely moves to report House Bill 4348 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. House Bill 4348 is reported with recommendation.
Representative Farhat moves to report SB 57 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes, and bless you.
Thank you.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. Senate Bill 57 is reported with recommendation.
Representative Vanderwall moves to report SB 58 with recommendation. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Woodsett?
Yes.
Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Kafia?
Yes.
Conlon?
Yes.
Farhat?
Yes.
Fitzgerald?
Yes.
Miller?
Yes.
Reingans?
Yes.
Vanderwall?
Yes.
Filler?
Yes.
Mueller?
Yes.
Van Workum? Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. Senate Bill 58 is reported with recommendation.
Now we will hear testimony on Senate Bills 44 and 45. To speak to the bills, we have the sponsors, staff from Senator Ueno's and Senator Santana's office. And joining us remotely, we will have Dr. Kelly Barashaj, a forensic nurse, to share her concerns about the bill as introduced. To begin, we will have Bill Drake and Nick Cook join us, and make yourselves at home and begin whenever you are ready.
Good afternoon, Madam Chair, Minority Vice Chair Vanderwall, and members of the House Policy Committee. I'm Bill Drake from Senator Paul Bueno's office, and this is Nick Cook from Senator Santana's office. Thank you very much for the opportunity to testify in support of Senate Bills 44 and 45 requiring informed consent for an invasive body exam. Unfortunately, the senators cannot be with us today because they are in budget and committee hearings. Senate Bill 44, sponsored by my boss, Senator Paul Bueno, and Senator Santana is the sponsor of Senate Bill 45. As you may be aware, these bills are a reintroduction of legislation that was introduced the past 2 sessions. And unfortunately, they did not make it through the entire process, but they did have hearings in both chambers. Senator Bueno's Senate Bill 44 would prohibit an invasive body exam on an anesthetized or unconscious patient by a health professional, including medical students who are in a health profession training program. Language in Senator Bueno's bill provides for certain circumstances when the exam is permitted without informed consent. First, if the patient's authorized representative has provided written consent and the invasive body exam is necessary for diagnostic or treatment purposes. Second, language is also included that states if the patient is unconscious and the exam is necessary for emergency or diagnostic purposes. We added the word emergency to the S2 in the Senate at the request of the Michigan Developmental Disabilities Council, who supported the bills in the Senate. And third, language in Senator Bueno's S2 before you permits the exam if it is court-ordered. This language was included originally from model language when the bills were first drafted 6 years ago. Removing this section is still under discussion in a proposed H1 version of the bill at the request of the Forensic Nurses Association. This was requested to try and prevent re-traumatizing a victim of a sexual assault, and I believe they are up next to testify. In addition, the senators both support this change. These bills are important for both patients and the medical community, including medical students, and passing these bills would allow Michigan to join the 20 other states that have adopted similar legislation that prohibits non-consensual invasive body exams. There is currently no firm data on the number of exams being performed on anesthetized patients here in Michigan. However, many health organizations have adopted consent forms to be signed by a patient, and in many cases, protocols have been put in place that has the doctor explain to the patient the student involvement in the process. Nick Cook from Senator Santana's office is here to speak on Senate Bill 45, which includes the definition of an invasive body exam. And again, Madam Chair, members of the committee, we appreciate the opportunity to speak in support of these bills.
Chair Rogers, Minority Vice Chair Vanderwall, and committee members,
Thank you for having us here to testify on Senate Bills 44 and 45. I'm Nick Cook. I'm the Chief of Staff for Senator Santana, who apologizes she could not be here today. Like Bill Drake had just said, Senate Bill 45 is pretty straightforward. It sets the definition for an invasive bodily examination, meaning a pelvic, vaginal, rectal, or prostate examination. Other than that, most of the emphasis of the bills is in Senate Bill 44. We stand ready to take any questions from you at this time.
And the bills are tie-barred together.
Thank you. Representative Roth.
Thank you, Madam Chair. Thank you, gentlemen, for being here. Just trying to go through my mind. Is it required to have more than one person in the room? I can't imagine a situation where there wouldn't be more than one person in the room if this is a surgical or emergency procedure. But is there any requirement in the bills to make sure there's a second person or witness, if you will, in the room during these procedures?
Representative, I believe we addressed that in new legislation that we took up in this body
that's what
last
I thought
year.
we did. That's
I'm helping him out a little bit.
Thank you.
Thank you.
Did you have any follow-up?
Nope, that's good.
Anyone else? Okay, thank you. Next up, we have the Oakland University School of Nursing Forensic Nursing Program Director, Dr. Kelly Bereshaj, to explain the concerns with the bill as written.
Thank you very much. Can you hear me okay?
Yes.
Good afternoon, Chairwoman Rogers, and the other members of the House Health Policy Committee. I appreciate the opportunity to testify before this committee in regards to both Senate Bills 44 and 45. My name is Kelly Bereshaj. I am currently the Forensic Nursing Program Director at Oakland University and also a forensic nurse. That means that I have received specialized education to conduct a medical forensic exam for patients following sexual assault. At Oakland University, I oversee the academic program and provide education to nurses who are also becoming forensic nurses. We collaborate with Turning Point of Macomb County. This is a community-based agency that empowers survivors of domestic violence, sexual violence, and human trafficking through comprehensive services and resources while advocating for community action to end oppression and violence. And our organizations do want to thank you for your efforts in bringing forward this incredibly important and insightful legislation aimed to help protect those who would otherwise be unable to advocate for themselves from having invasive exams conducted without their consent. The first three conditions outlined within the bill that must be met prior to conducting an invasive bodily exam are critical, as they require informed consent and or the need for emergency diagnosis and treatment. And we are in full support as these conditions are in alignment with the Universal Declaration of Human Rights, as well as healthcare provider ethics. The fourth condition, entitled "A court had ordered the performance of the invasive bodily examination for the purposes of collecting evidence," falls outside of these principles, as there is no medical indication for such a procedure and informed consent had not been obtained. And for this reason, we ask to strike the language of "a court has ordered the performance of the invasive bodily examination for the purposes of collecting evidence" from Section 2D. Informed consent to medical treatment is fundamental from an ethical and legal perspective. Specifically, informed consent means that the patient or their legal surrogate has received information from the clinician who will actually be providing the procedure. The patient and or their surrogate understands the purpose of that procedure. They've had the opportunity to ask questions, hear alternatives if any are available, and learn about the benefits and potential risks. Only then, after they are informed, can consent be obtained. An invasive bodily examination, like a genital exam, requires informed consent because there are inherent risks from this procedure, physically, psychologically, and also legally. As a forensic nurse, my specialized training in providing a medical forensic exam includes conducting this invasive bodily exam with specimen collection that holds potential evidentiary value. Unfortunately, this education with specimen collection is not part of healthcare provider training. And so as a result of that, without proper training, there's an increased risk for harm to the patient, including physical, genital injury, pain, possible dysfunction, as well as psychological injury such as anxiety, depression, or PTSD. Further, lack of provider training related to collection of samples with evidentiary value could result in the improper collection or cross-contamination, leading to a miscarriage of justice. And despite the fact that forensic nurses have this specialized education, we are ethically and legally bound to conduct the exam only if two conditions are met. One is that the patient's history dictates that an exam is warranted. The second is informed consent is obtained from the patient. Conducting an invasive exam on an unconscious patient who is unable to provide a history, has not given consent, and is receiving the exam solely for the purposes of collecting evidence does not align with ethical and legal practice, and in fact constitutes an assault. It would be of great concern that a court without a medical foundation or education could order a forensic nurse or other healthcare provider to perform an invasive exam on an unconscious patient strictly for the purposes of collecting evidence. In addition to the inherent risks just described, it would be tantamount to treating this individual who may have been victimized as a perpetrator. When there is no medical rationale, there is actually no indication to consult a healthcare provider. And in these instances, the clinician would be functioning as an extension of law enforcement, not as a healthcare provider. When we as providers do not function within our scope of practice, it is considered malpractice. Additionally, we would lose our ability to testify within the medical exception to hearsay. In cases where forensic nurses do collect samples with evidentiary value, after obtaining consent in alignment with the history, it is important to note that legal justice is not always an outcome. Historically, a large portion of persons who have been sexually assaulted do not report their assault, whether it be to law enforcement or healthcare providers. And even if they do, they may choose not to have an exam, they may choose not to have evidence collected, or they may choose to not release that evidence to law enforcement. In 2022, only about 20% of victims reported their sexual assault to law enforcement. So collecting samples from an unconscious patient who may or may have not even been assaulted and simply for the pursuit of justice neglects the individual's right to determine what happens with their body. Finally, it's important that research indicates that evidence may be now collected outside of our 120-hour timeframe that we follow in Michigan. In fact, evidence may be viable up to 7 to 10 days in some cases, and colleagues of ours in other states will collect up to even 15 days. This allows for additional time to locate the patient's next of kin or seek guardianship to ensure that someone is making decisions in the best interest of the patient if they are unable to do so for themselves. And it is truly evident that the intent of Senate Bill 44 and 45 is meant to protect patient autonomy, and we are incredibly happy to see this. However, autonomy would only be truly achieved by eliminating the condition in which a court can order an invasive bodily exam without a medical purpose solely for evidence collection. I truly appreciate your time and thank you for allowing me to address the committee, and I'm happy to answer any questions. Thank you so much.
Thank you. I think we have Representative Filler.
Yeah, if it's okay with you, Chair, Representative Mueller can phrase the question a little bit better. We had a similar question.
Okay, Representative Mueller.
Thank you so much.
Thank you. Coming from a law enforcement background, I just want to be clear on what's going on. For instance, let's say you go to a call of someone that's been kidnapped or sexually assaulted. You kick in the door of a motel, and you have a victim there, unconscious, maybe a drug overdose or beaten, and you want to get a search warrant to make sure that you preserve any evidence from the scene. The offender's not there. You don't know who it is at that time. And you want to be able to collect DNA samples or blood samples or, perform a SANE kit on the individual because you don't know if she was raped or not. And you get a search warrant. Would the search warrant still be upheld? Or that's what I'm trying to figure out. If you get a legal search warrant, are you going to be able to collect that information, or are you going to have to wait to get consent?
Is that a question for me? I'm sorry.
Yes.
Oh,
Yeah.
I mean, in our world, A search warrant is generally conducted to collect evidence for us off of a suspect. And so in the cases of our world, we deal with a patient. My realm is healthcare. My concern, first and foremost, according to our nursing code of ethics and our medical code of ethics, is related to the health and wellness of the patient. And so while legal outcomes can be important, first and foremost, my patient's health and safety dictate the direction of my care. So search warrants generally are not part of our world unless it's related to a suspect exam.
Okay, do you understand what I'm saying though? Is if you have somebody there, and if the university or the hospital refuse to execute the search warrant, and then you possibly could be victimizing the victim again if you don't do the SANE kit or the CSC kit. Do you see what I'm saying? I ran into that before where doctors and nurses wouldn't cooperate with certain things. I just don't want to make it hard because we don't want to re-victimize a victim in certain circumstances. So we want to make sure I understand your intent, but we also don't want to tie the hands of law enforcement at the same time because it also affects the victims.
The point would be if the victim wanted to move forward with prosecution. And in my experience dealing with patients, we have anywhere from 50% of our patients that are there only for medical purposes. They do not want sometimes evidence collected, and they do not always want their evidence released. The patients that I do see, as I said before, that's only about 20% of the population that are being sexually assaulted because they don't want anything to happen with their case at all. And so I understand what you're describing is a much more serious issue, but potentially by us conducting an exam where a patient hasn't consented, I myself am assaulting that individual. And so in addition to not only potentially re-traumatizing a patient by conducting an exam that they would otherwise not want, that is actually potentially traumatizing all of the healthcare providers involved in as well, with us having to be involved with what we feel would be assaulting a patient. So there's many more traumas that are occurring surrounding conducting a potential exam without the consent of a patient. More often than not, a patient is going to be able to regain the ability to consent for themselves, or we will be able to find someone to provide that consent for them. It is going to be the very rare case that a patient has a sustained traumatic brain injury outside the confines of our ability to collect evidence that we wouldn't be able to find someone to consent on their behalf. By conducting this examination, we're assuming that that individual would want us to do so. And in fact, we know that may not be the case. So the sole purpose for us conducting the exam would not be for the medical health of the patient. It would be specifically for legal outcomes. And as a nurse, I'm a healthcare provider. I am not an extension of law enforcement, and my job is not to prosecute crimes. I understand I should not be obstructing that in any way, but I also should not be operating outside of my code of conduct, or I would be in a malpractice realm.
Thank you. Any other questions? Representative Thompson.
Thank you, Madam Chair. You brought up a good point, and I think that that's the clarification that I was looking for. So if you had a patient that was unconscious or unable to give informed consent and you couldn't contact a family member, and something called for a symptom or something became apparent that a vaginal exam or any type of exam needed to be done because that was to make sure that the health care was provided, that would be okay. But if it was to obtain evidence without the consent, then it would not be okay. So is that the contrast that I'm hearing?
Yes, correct. Thank you for clarifying that. Of course, if medical condition warrants that a patient receive a genital exam, a gynecologic exam, of course. For example, they might have bleeding from, their vulva and vagina. They may have the same from their rectum. And so, yes, to do diagnostic testing, to do an examination to ensure that the patient is healthy and safe, of course. But a routine gynecologic exam is not something that we do. What's important to note is I'm sorry, I don't remember the gentleman that spoke up, if he was a detective or an officer. The large portion of time, patients that are sexually assaulted, they fortunately have minor injury that do not require significant invasive examinations or diagnostic treatment and purposes. But yes, a patient that is going to be hospitalized may have more severe injury. And so if a medical exam is warranted, of course.
Thank you. Are there any other questions? We have cards to read in. Supporting the bills from Michigan Nurses Association, supporting both bills. Lara, supporting both bills. Michigan State Medical Society, supporting both bills. Michigan Domestic and Sexual Violence Prevention and Treatment Board, supporting both bills. American Association of University Women of Michigan, supporting both bills. And Michigan Council for Maternal and Child Health, supporting both bills. Oh, we have a correction. Michigan State Medical Society was supporting 4347, 4348, Senate Bills 57 and Senate Bills 58. I apologize. Thank you, everyone, for joining us today. Please let the bill sponsors in my office know if you have any suggestions or concerns with Senate Bill 44 and 45 that we heard testimony on today. I don't think we had any absent earlier.
No, we don't.
There being no further business before the committee will stand adjourned.